Welcome to another episode of Quick Medical Review, where we unpack essential medical topics in under 5 minutes. Today's topic is von Willebrand disease, the most common inherited coagulation disorder. Von Willebrand disease is primarily due to a genetic deficiency of von Willebrand factor, which plays a critical role in hemostasis. Von Willebrand factor facilitates platelet adhesion to damaged endothelium and also stabilizes factor VIII in circulation. This condition is typically inherited in an autosomal dominant fashion. There are three types of von Willebrand disease. Type 1 is the most common, involving a partial quantitative deficiency of von Willebrand factor. Type 2 is a qualitative defect. Von Willebrand factor is present but doesn't function properly. Type 3, the rarest and most severe, involves a near complete deficiency of von Willebrand factor. It's important to note that von Willebrand disease can also be acquired. A classic example is Hayes syndrome, where von Willebrand factor is destroyed in the setting of severe aortic stenosis, often associated with gastrointestinal arteriovenous malformations. In this case, turbulent blood flow contributes to von Willebrand factor degradation. Clinically, von Willebrand disease presents with bruising, petechiae, epistaxis, menorrhagia, and notably prolonged bleeding after procedures like tooth extraction. These symptoms reflect defects in primary hemostasis due to impaired platelet adhesion. Now, let's talk diagnosis. First, a complete blood count is usually normal as platelet number is unaffected. Second, the coagulation profile shows elevated PTT due to reduced factor VIII while PT remains normal. Bleeding time is prolonged, reflecting the platelet adhesion issue. Von Willebrand factor antigen levels are reduced. And finally, the Ristostin cofactor test is abnormal. Platelets fail to aggregate because von Willebrand factor can't properly bind to the platelet receptor glycoprotein IB. Management depends on severity and type. For mild to moderate bleeding, desmopressin is the treatment of choice. It stimulates the release of von Willebrand factor stored in endothelial cells. In more severe cases, or in those unresponsive to DD or VP, we use recombinant von Willebrand factor or factor VIII concentrates rich in von Willebrand factor. And that wraps up our review. To summarize, von Willebrand disease is the most common inherited bleeding disorder, often presenting with mucocutaneous bleeding. Diagnosis is confirmed by prolonged bleeding time, elevated PTT, and abnormal Ristostin test. Treatment is tailored based on type and severity, with desmopressin or von Willebrand factor concentrates forming the cornerstone of therapy. That's it for today's quick medical review. If you found this helpful, share it with a colleague and subscribe for more clinical gems every week. Until next time, stay sharp, keep learning.